Good day everyone, I am Michael Josh G. Santa Maria and today I will be presenting the importance of infection prevention for healthcare workers. This topic is very important because healthcare workers are constantly exposed to different types of infection while caring for patients. To begin, this presentation will discuss what infection prevention is, why is it important, common infections and how they spread, and the role of healthcare workers in preventing infection. First, hospital and healthcare facilities are meant to be places of healing. However, without proper infection prevention, this place can also become source of infection. For example, a patient may acquire infection not from their illness but from unsafe practices inside healthcare facilities. In addition, healthcare workers are exposed to infections daily because of frequent contact with patients. For this reason, infection prevention is essential in protecting patients, healthcare workers, and even community outside the hospital. Before discussing its importance, it is important to understand infection prevention means. Infection prevention refers to a measure and practice used to stop the spreading of infection in healthcare settings. These measures control harmful microorganisms such as bacteria, viruses, and fungi. Ultimately, the goal of infection prevention is to protect patients, healthcare workers, visitors, while maintaining a safe and healthy healthcare environment. Now that infection prevention has been defined, we can understand why is it important. Infection prevention helps prevent healthcare-associated infection, also known as HAIs. These infections are dangerous, especially for patients with weak immune system such as elderly, newborns, and those with chronic diseases. As a result, proper infection prevention reduces hospital costs, shortens hospital stays, improve quality of care, and most importantly, it saves lives. Next, let us look at some common healthcare-associated infections. Examples include COVID-19, tuberculosis, hepatitis B and A. This infection can easily spread in healthcare settings due to close contact, shared equipment, and crowded environment. Because of this, proper infection prevention is necessary to control the spread of this infection. To better understand how infections spread, it is important to discuss the mode of transmission. Firstly, direct contact transmission occurs through physical touch. For example, a healthcare worker may become infected by touching a patient's wound or body fluids without proper infection. Secondly, indirect contact transmission happens when a person touches contaminated object or surface. An example of this is using unclean medical equipment or touching a bed rail that has germs on it and then touching the face. Additionally, droplet transmission occurs when an infected person coughs, sneezes, or talks for an instant. Respiratory infections like COVID-19 can spread through droplets when masks are not used properly. Lastly, airborne transmission happens when infectious particles remain suspended in the air for a long period. Diseases like tuberculosis can spread through the air, especially in poorly ventilated areas. Understanding this mode of transmission helps healthcare workers apply the correct prevention measure. Given this mode of transmission, infection prevention must be strictly followed. These include the proper hand hygiene, correct use of personal protective equipment or PPE, proper waste disposal, regular cleaning and disinfection, and vaccination of healthcare workers. When these measures are practiced consistently, the risk of infection is slightly reduced in healthcare settings. Among all infection prevention measures, hand hygiene is the most effective. Hands can easily carry germs from one patient to another. Therefore, healthcare workers should perform hand hygiene before and after a patient contact, before aseptic procedure, after contact with body fluids, and after touching patient surroundings. Simple actions such as proper hand washing can prevent serious infections. At this point, it is important to emphasize why infection prevention is critical for healthcare workers. Infection prevention reduces occupational health risks and protects healthcare workers from illnesses. Not only does it protect healthcare workers, but it also prevents spreading infections to patients, co-workers, and family members. This also promotes professionalism and ethical responsibility in healthcare facilities. On the other hand, failure to follow infection prevention practice can lead to serious consequences. These include increased infection rate, patient complication, or even death. In addition, poor infection control can result in legal and ethical issues, staff shortages due to illness, and damage to reputation of healthcare institutions. In conclusion, infection prevention is a shared responsibility in healthcare. Healthcare workers play a key in preventing the spread of infection. By consistently practicing proper infection measures, we protect ourselves, our patient, and the community. Ultimately, infection prevention is not an option, it's a duty. Thank you.